Good evening, everyone. It's very nice to have all of you on board in this evening, where we are going to go through a very interesting subject on leadership. As we all know that leadership is a very key and very important factor as far as organizational performance is concerned. My name is Gladness Salema. I'm a senior lecturer from the University of Dar es Salaam Business School, and I'll be your moderator for this session. So this evening, this is webinar number 3, and it's a continuity of the other 2 webinars, which is part of capacity building to the medical commodity supply chain practitioners. And today, the main topic is on leadership in global health procurement and supply chain management. And this project is supported by the Global Fund, and it has been implemented by Empower School of Health. So we welcome all of you in this very important evening. And today we have very important people. These are experts in the field. That is the pharmaceutical supply chain field, both from the human resource development perspective, but also from the technical perspective. So it's quite a very resourceful panel. We have our keynote speaker, that is Mr. Daudi Msasi. He's the chief pharmacist from the Ministry of Health, Tanzania. We have also Mr. Marasi Mwencha, who is the head of supply chain from Global Fund. We have Professor Paul Lavon, who is the director of Empower Group, and he's also an expert in the pharmaceuticals supply chain management. We have Mr. Shimelis, who is a specialist in supply chain, also from Global Fund. And we have Jen who is a deputy chair from People That Deliver. She's an expert in human resource development. Thank you so much, Jenny. We're happy to have you this evening. And we also have Professor Andy, who is an expert in the area of pharmaceutical supply chain management. Also has a very wide experience as far as capacity building in the area. So Professor Andy is also from Empower. Next. Myself, I have an interest in pharmaceuticals as supply chain, both in terms of teaching, but also in terms of research. That's why I'm here. So I'm also an interested stakeholder. Now let us go to our housekeeping. Yeah, for all the participants, we'll request you to mute your microphones and turn off your videos so that at least we can have a stronger internet connectivity, because sometimes it interferes. I would also like to have so many questions from you, and please use the chat box and also raise your hand when you want to ask a question. That we have a question and answer session at the end. And we also request all participants to participate in the poll that we'll have, so that your interest will be captured. But also it's important to note that this webinar is being recorded, and it will be available through the YouTube channels under the Empower School of Health. But also the slides will be shared with all participants, and we request you to fill the feedback form at the end of the webinar so that we can know areas for improvement. As we understand, with the current situation, webinars now are becoming the most common ways of engaging the community and the stakeholders. But also what is very important is that the participants will receive the certificate of participation at the end, after they have completed all the steps. Next. Also, we request you to turn off your cameras, as I said, mute your microphone, and let us also follow the presentation schedule so that we get advantage of the little time that we have this evening. Next. Now let us understand why we are here this evening. is that the main objective of this webinar is to impart knowledge, or I can say sharing knowledge about leadership and its fundamentals in the context of global health and pharmaceutical supply chain management. So specifically, we'll explore what are the traits of an ideal leader. So it will be very interesting to know this evening whether leaders are born or leaders are made. So this will be quite an interesting question to be answered this evening. But we also come to understand better the differences between administration, management, and leadership. As we know, we have different participants this evening. So who is really doing leadership? At least to understand the difference will help us. But also we learn or we share experiences as far as the leadership styles are concerned. And I think we'll be able to know whether we're having the right leadership styles as far as our pharmaceutical supply chain is concerned, given its uncertainty. You know, what type of leadership do you actually adopt in your areas? And this evening, it will also be an opportunity for the participant to be able to answer their question about what type of leaders they are, you know, based on the situations, you know, based on the leadership styles that they have adopted and the work environment. But we also come to understand what are the potential pitfalls in the leadership styles. So at the end of the day, we want to understand what are the effective leadership styles as far as our context are concerned in the medical commodities supply chains. Next. So we'll start with, we have already given the welcoming remarks, and we'll have the first poll of all the participants. But next will be a keynote address from our chief pharmacist. This is from the Minister of Health, whom will talk more on the capacity building initiatives and generally about public health supply chain leadership in Tanzania. But we also have a short discussion and presentation from Global Fund on their support to their Ministry of Health. This one will be done by Mr. Shimeles. And we also have an address from Jane, who is from the People That Deliver. She will share her experiences, but also the importance of developing our people in terms of the professional development, teamworks, and so forth. But we also have a presentation from Empower School of Health, who have implemented this particular project. And for those who are new today, that's your first time that you're attending this webinar. As I said, this is a continuity from the previous webinars. We had the previous two webinars. And the idea is that Empower is supporting the Ministry of Health as far as capacity building is concerned. So we hear from Professor Paul in terms of what is Empower School of Health doing, you know, and how are they engaging in the pharmaceutical supply chain capacity building. And then we see one of the output from the project that has been implemented by Empower with the support from Global Fund, the e-learning course. And here we also have, we'll be exposed to the supply chain game, which has been developed by Empower. This is quite interesting. I encourage all of you to make sure that you are there to observe this, this game. And the presentation will be done by Professor Andy, who is also from Empower. Then we'll have a feedback from the soft skills assessment, which was done with the online capacity needs assessment that was done previously. And this one will be done by Siddharth, who is also from Empower. And then we'll have, we'll go to the real business, that is a discussion and presentation on leadership and change management in the context of public health supply chain management. And it will be done by Professor Paul. Then we have our floor open for question and answers before we finish with the next poll. Next. So this is our first poll. I encourage all the participants, please quickly let us fill this poll. Try to fill all the questions. All participants fill all the questions. All participants, please fill all the questions. The numbers are still very low. Yes, thank you.
So we ask about your gender, your age, understanding your management background and experience, your staff that report to you, your academic background, and how you heard about this particular webinar.
Yes, thank you, Prof. So these are just very basic questions, but very important as far as the future initiatives are concerned. Just simply indicate what is your gender, what is your age category. Your management experience in terms of also the number of staffs who reports to you, because this is about leadership. The staffs who report to you are your followers, so this is very important. Your academic background. And also, how did you hear about this webinar? This will also be very interesting to know. We're 60%. Please, let's try to fill all the questions. 63%, 64%. %. Yes, can we have more? Yes, please, 70%. 71. It's 75, maybe it's enough. Maybe it's enough. We have 71% who are participated in the poll. We are ending the poll. 72%. Yes, so these are the poll results. The results shows that we have about 76% of our participants are male, of those who fill the poll anyway. And in terms of the age category, majority we are in the age of 30 to 40 years. That is 57%. And in terms of management experience and how many staff report to you, the results of the poll indicate that majority have more than 10 staff reporting to them. So this is quite interesting, and I think this will be a very useful webinar to learn about the leadership of these people, how to lead these people. In terms of academic background, majority they are pharmacists, that is 67%. And how did they know about the webinar? Majority, that is 74%, indicated that they knew it through the WhatsApp. So we see now the power of the social media. Yeah, thank you so much for participating in this webinar. Next. So now we have the opportunity to get a keynote address from the chief pharmacist. That is Mr. Daudi Msasi from the Ministry of Health. Daudi Msasi is the Director of Pharmaceutical Services and the Chief Pharmacist at the Ministry of Health. As also the Chief Pharmacist, he's responsible for ensuring the provision of quality and equitable accessible pharmaceutical services at all levels of the healthcare delivery in the country. Prior to assuming this position, that was in December 2017, Mr. Msasi served as the acting director of customer services and zone operations at the MSD headquarters, that is the medical supplies department, where he was overseeing the proper storage and distribution of health commodities nationwide, while ensuring that the MSD sales, marketing, and customer service were operational to enable MSD to provide effective and satisfactory services to its customers. He holds a Bachelor of Pharmacy degree from the University of Dar es Salaam and an MBA in Human Resource Management from St. Augustine University of Tanzania. Mr. Daudi, karibu sana. You are warmly welcome this evening. We'll be very happy to hear from you, and we appreciate for your commitment in this endeavor because we understand that you have a lot of responsibilities. Please, the floor is yours.
Asante, asante, and thank you, Gladness. And I feel honored at this time to join you and the team and have something to say on the issue that related to the leadership on the supply chain and procurement issues. So once again, thank you, Paul. Thank you, my team from Global Fund. I saw, are you with the, but you make me not to remember again the name quickly because you have put only two dashboard on your back. That is Ghana and Uganda, not Tanzania. You see, Shimelis? Shimelis, are you there? Hello, Shimelis. So thank you, Paul, and thank you, Marasti, and the other speakers. I can see Shimelis, I saw Jenny, I saw Prof. Andy, and the rest of the team. And thanks, colleague, for joining this webinar. And I'm sure we are going to share a lot in terms of leadership on the supply chain. Once again, as Minister of Health, the Chief Pharmacist, on behalf of the ministry, we really thank Global Fund for financing this webinar. And this is I think this is the last session of which we are supposed to hold it on January. Because of different activity, we didn't manage it up. So we apologize for that, but yet we thank you for keeping up with us to ensure that this webinar is going to happen. And I can see today it's happening. So we are ready to go through it. And I'm sure there are so many people who will join. And we will learn from it, from what you guys actually have intended, prepared for us. So because this is the third one, remember this is the third one, including the live one of which it wasn't the webinar as such. It was the face-to-face meeting that happened in Molena in Dodoma last year. So I welcome you all at this webinar for sharing the knowledge that we have, asking questions, and let our keynote speakers address it and provide the answers of which everyone actually will have something to gain from what is going to be presented today. Being that said, I will share some few areas of which I want to emphasize regarding the innovation in capacity building and leveraging with the digital tools for large-scale training. We all know we are in the situation where it's not that much easy for us to meet and have a discussion. So we have to see the alternative way of how do we share the knowledge that we have and how do we keep improving the capacity of those who are actually on the field providing the service. I ought to call for all the colleagues to use the smart technology that is happening now, whereby we can be able to monitor and see how the commodities are dwelling at the facility, at the service delivery point. By doing so, you might be using the mobile phone, trying to ask, questioning, getting the information. People will be reminded and see how important for them to are there at the time that we are setting at those facilities. This includes knowing if whether our colleague at the facility are using the document that we have prepared, including the management tools, actually, the dispensing register, commodity register, bin cards. We should be tracking them if you're using the mobile phone where you are. You can even ask for him to take a picture and then send it to you. And so that you can see whether it's updated or it's moving forward or not. At that time, we can be in a position to intervene and see how do you help those colleagues at the service delivery point to ensure that they are there, those ones. Actually, I'm calling upon for, as a leader, we have to ensure that the efficiency use of VLMIS. We have currently the MSD portal. We have the GoToMIS. We have the Afya Care. We have the so many platforms of which the ERP that are operating on the supply chain. So we have to ensure that we know them, and we lead the reports from those information systems that we have. Help those at service delivery point to analyze those data that we are getting from those reports. Provide them with the feedback through the electronic means where you are. You might be in the office like now, I'm in Dodoma. I might be building those information, trying to analyze them, and then sharing the feedback with those people who are generating those information at the facility. By doing so, we'll be helping them to remind to go back to their roots and ensure that their problem they can rectify. If there's anything that is a success story, you have to have a time to provide the feedback and congratulate them on what they are doing. And because we know currently, as I said earlier, it's not easy for us to meet, or sometimes we're not traveling, having those informational training, but yet we can use the Zoom as how we are using it now to get other people trained, know what they can do at the facility. And whenever we get the chance to be at the facility, let's emphasize on the on-job training. Those people, they need to be reminded. They need to be kept alive on the information systems, on the management tools, on the supply chain issues, on the procurement, of which is actually kept changing from now to then. But we might be in the position to know exactly what is happening on this arena. But them being at the facility, being quite busy, taking care of the patients, doing everything, probably they are 201. So they need to share, to get the knowledge that we can have at this level, and then share with them down there. You can share, as I have said, you can share through Zoom, you can share through the mobile, you can share, you can set whatever sort of meeting that will ensure that those people are well kept with the vast of knowledge that we have. And yes, we have to see how do we monitor the guidelines that we are developing. There are so many guidelines. Even asking the facility, those at the service delivery points, even asking them whether they know some of the guidelines that are lying at your office. If they don't know, so see how do you share with them, whether through the electronic platform or by sending them the hard copy, and take them through to ensure that they are there, those guidelines. Because currently we are facing a lot of challenges on the supply chain. Probably most of the solution on those areas of which we are facing, they are within the guidelines. There are so many guidelines that down there, the supply chain, we have developed them. So they might not be being correctly used, or they might have not been even seen by those people who actually they are in touch with the patient, in touch with the health commodities. Let's use this platform. Let's use whatever that we have as electronic mode to ensure that they go through those guidelines. They can lead it. They can own and be able to utilize. We'll solve a lot of queries that we are now in on supply chain issues. And as a leader, we should be concerned. Actually, as a leader, we have to be concerned with the situation. Because currently, if you see the management tools are not being used, the commodities are not that much adequately available, because you could see there are so many people may be asking for the commodities. Then in that situation should actually raise an alarm, and then you have to be concerned as the leaders. Leaders should be concerned with the situation and be ready to solve it. You need to be creative as a leader. We have to be very creative to ensure that we solve those concerns that we see. Let's keep the creativity very alive on our minds as a leaders. This involves developing up the platforms, creating up the guidelines, coming up with some of the policy statements, developing them to ensure that we really address the concern that is happening on that ground. But again, you have to have the consensus, because sometimes we might be sending some of the information as a leaders. We are sending a lot of information to the facility, but their adherence might not be to 100%. And then if that the case is happening, as a leader, we have to take an initiative and see what are the issues, what are the problems. If I say as a leader, this is the actually what I wanted those people to deliver, but they are not delivering, what are the issues? Then you should come to consensus, agree, and see the easiest way of solving the query that we can see. That is the leadership and management of which you want to see. Leadership in supply chain want to see. You have to engage people and see how are you addressing their problems. Having the consensus and you are in line with everything with the one that at the facility, then let's keep to be consistent. If there's a need for you to fill up the management tools, let's keep that not be actually as a daily blade. Let's see how do we fill those information daily and provide the report that are required. As a leader, I feel we need to keep on building the competence to those people who are working at the service delivery point. You can do it in various ways, including the platform that I have mentioned earlier, to ensure that those people are very competent, they can deliver, they can provide reports, they can analyze their data, they can use those information to ensure that they deliver. Currently, we have the program of, we call this an impact. Is something that is there and have been developing it and have agreed, and currently it has been signed. So we have that guideline to guide us on the impact approach. So let's use those platforms to ensure that we improve the competence and the people can use the data and information to analyze whatever that is available at those facilities and provide the feedback, and they can be able to solve those challenges. And after the other area of which I think as a leader, we need to keep on our mind, and we need to practice it. We should have a control. And if you have the control, then you can command. Whatever that we feel, that is the something that we can stand for. So let's build that capacity for the people to have a control on what they have been given to monitor or to stand for. And they can command those people who are actually reporting to them to ensure that they get the information, they get the report. Those are the quality of which we need to empower and to impart on those people who actually they have the law to supervise and monitor what is happening down there. It's another key area of which I want to talk about is collaboration. We need to work as a team. We all need each other, because I'm sure I'm in the office in Dodoma, but something that is happening in Katavi now, I might not be able to know what is happening at that ground, at that level. But working as a team, so the one in Katavi can get the report to the district council level, and then the pharmacist at the council can share it with the regional pharmacists. The regional pharmacist can share with the pharmacist at the PORAG. And the same time, we can share it with the Minister of Health. For having us all on board, working in collaborative work, where we can be able to solve a lot of issues at the ground there. And those people at the facility, not only we are helping, but also we are solving their problems. And finally, leadership in supply chain or leadership management, at least you need to be highly committed. I see there are so many issues that going on around the supply chain, but all we know, there is no program, there is no health, there's no anything if there's no commodity at that facility. There's no if there's no commodity, there's nothing that will be happening across on the supply chain and across on the issue related to provision of health services to the people. So let's be committed and see how we address the issue at the ground, and how do we help those which we are given the task to supervise the deliver, and ensure that the people at the service delivery point, they can get the service that are needed. It all goes with having the high level of commitment and integrity at the same time. It has to be given its priority. Being that said, let's keep learning new technique on how best we can address our issues and deliver the quality services to those who are in need. Once again, thank you, team. Those are my comments. It might be times as an opening remarks, but those are my comments. I want the people to change and see how we address the situation that we are in by being concerned. We have to be creative. We have to get the consensus on what the new development that we want to achieve. We have to be consistent to achieve what we have built up. We have to get people who are competent by building their competence. We should be in control of our issues on the supply chain, and we should have the command. Having the command, you should be knowing what you want to achieve, then you can have command. Let's work as a team and be committed. We'll achieve a lot on this arena. Thank you. Once again, thank you, team.
Thank you so much. Thank you so much, Chief. I would really appreciate for your very good inputs. Actually, you have really helped us to have an understanding about what is happening and the role that leadership has to play. From the discussions that you brought out, I was able to pick a very important issue that seems to be very critical, the issue of non-compliancy to the institutional framework, that is the guidelines, the different tools that we have, many of them, and still seems like the impact of having all this has not been felt. So this is also something very important to be brought up this evening, because it really provide the rationale as to why we have to discuss the leadership issue this evening, because we expect leaders to carry the vision and to make sure that whoever is following them, they are also in the same direction, in the same track. You also raise the issues of competencies, and you also raise the issue of collaboration, I can say also integration, in terms of both the two mother industries. I usually say they are the mother industries as far as the health sector is concerned. That is the PURAG and the Ministry of Health, but also the collaboration vertically from the health facilities themselves up to the ministry. So that is something very, very important as far as I think leadership is concerned. And I believe from the coming presentations, we hear more and maybe even get suggestions about how now can we move forward from these kind of observations. Yeah, you talked about creativity in terms of problem solving. So you talked about teamwork. Okay, so all of these are very, very important issues as far as leadership is concerned, but you were also you also brought up issues of behaviors like more of commitment, integrity. So we are looking forward to hear more about how the discussions on leadership, and I know Professor Paul is ready when he has to talk about leadership, he'll be able to reflect all these kind of issues. Thank you so much, Chief, and we are looking forward for more inputs. Yes.
Yeah, just to add to Chief Pharmacist's points, I think it's important to emphasize. It was interesting. I don't know if you realized, but some of the points, many of the points you mentioned, all aligned with the letter C, and it was actually quite accurate. Many of the points will also come out later. For a leader to be creative, to be able to respond to crisis or change, to ensure he or she can develop consensus, to coordinate and collaborate, to create impact, and to be committed. All very powerful points. You'll see some of them repeat later on. And to connect it with the team of, we have now more than 100 people between Zoom and Facebook on this webinar. We have a young team out there between 30 to 40 years old. Relative to many other countries, that's a young team. And many of them have at least 10 people, almost 60% have more than 10 people that are reporting to them. So leadership and management become critical. And more than, again, 60%, almost 70% have a pharmacy background. And I remember in pharmacy school, we don't emphasize as much about leadership, management, governance, and accountability. So really important that these things are picked up on the job, face-to-face and online and through other mechanisms. So thank you very much for your words, Chief. Appreciate it.
Okay, thank you. You're welcome.
Next. So the next presentation, this one will be from Shimelis. Shimelis is from Global Fund. Can we see his profile? He's a specialist in public health supply chains, and he has been engaged with programs and projects which fight against AIDS, tuberculosis, and malaria. He's working with country teams in Africa, that is including the country team in Tanzania, but also in Asia to implement the health supply chain transformation, which will contribute to the overall strategy that addresses the core objective also of Global Fund. Shimelis, you are warmly welcome this evening. We'd like to hear from you. The floor is yours.
Thank you so much, Gladness, for the opportunity. And thanks so much, Mr. Daudi, Mr. Paul, also for organizing this efficient way of training, which actually as one of the pillar of supply chain governance is quite a critical area for us. And with COVID restriction, actually, the method we are using in Tanzania is actually the way forward for us. The way we call it a blended approach of both few number of days in classroom and follow that up with additional webinar, which we are now doing in Tanzania for the third time. And I think for us, we don't want to stop here. I think we want to make sure this is sustainable. So that's why we are also creating the e-learning platform, which will be part and the parcel of the system strengthening. And of course, we want to do this in a coordinated manner with other stakeholders in country and globally, so that we avoid any redundancies. Also, we save resources. Global Fund also provides other areas of support, or in the parallel to the grant implementation, we want to also support supply chain portal development. We also want to also support the data systems, and also we want to provide other areas, for example, in supply chain reform where necessary, but we want to also act like catalytic or more strategic than competing with the grant or what USAID is doing. So we are more focusing on leading other stakeholders on where to focus. Then we hand over when those interventions are mature. In terms of sustainable governance, we provide supply chain workforce assessment, supply chain master plan development, human resource for health, capacity building in specific areas. Also, of course, we do in the stage evaluation of project. We want to also see the impact of our investment. So when we hand over, like for example, we expect Empower to provide us training assessment. Where we started, and what was the impact of this intervention specifically. We also provide other areas of support like planning and innovation, especially focusing on the use of data, strengthening the LMIS, strengthening the forecasting and supply planning, working around HMIS, LMIS integration, operability, and of course, integration across program and integration, of course, across supply chain, both physical and the system data wise integration. We also look at supply chain segmentation. For example, supply chain network design, where we use if you see my my background in some of the work of Llama software, they provide us efficient way of last mile delivery, warehouse locations. We also provide inventory optimization support, design of differentiated distribution models, order management process redesign, and also we want to provide also support in areas of waste management, reverse logistics, in ensuring that there is efficient way of using resource. Finally, we also, in the next 3 years, we also want to provide support around private sector engagement, where we also bring private sector, as we believe private sector, Global Fund's one of model is public-private partnership, and private sector has the technology, the management capacity, the project management skill, and the public sector has the knowledge of the system. And when they come together, I think they can really impact the supply chain. And in that aspect, we want to provide support around public-private partnership, policy development, developing partnership and governance models, including looking at how supply chain is governed in country, globally in coordination with the interagency supply group. We also want market private sector maturity assessment, like the one used the NSCA or the Gates or the UNICEF supply chain maturity, because these are the techniques which gives us where are the supply chain systems in country and what are the gaps and what lessons can be learned and the best practices are there. So we also want to work around there, and we also want to develop framework contracts and service level agreements, and we want to benchmark other countries, and where there are issues in other countries, we want to facilitate teams, for example, MSD team to travel to other country, or Minister of Health or other countries, like for example, Malawi came to visit MSD last year, because the model used at MSD is quite sustainable and very efficient. So these are the things we want to also facilitate going forward. And we look forward to collaborate with the team in Tanzania, and also the country team, and also other stakeholders. And feel free to contact us for any support you want, be it financial or technical. As we believe a demand-driven supply chain is more efficient. We just don't want to tire you coming back and again, telling I want to work around this, but we always give guidance, but we expect country to come back to us that please support around that. This is our gap. And in that aspect, we really appreciate for the support we received from Mr. Daudi's team. And I wish everyone a good training session, and thank you so much. Over.
Thank you very much, Shimelis. That was very useful. And I picked a lot of things from your presentation, which include the support that you have to the transformation of the supply chain. And based on what the chief pharmacist said, I feel there is a connection as to why we have to discuss all these opportunities, because all the issues about non-compliance to the institutional frameworks and so forth, issues of monitoring control, all of these are considered as governance issues along the supply chain. So it's quite interesting, and it's quite encouraging that we are addressing the issues that even the development partners have already looked forward for them. So thank you so much, Shimelis. And we are continuing with the next presentation, that is from Jenny. Jenny is from the people that deliver. She's the Chief Operating Officer of SAPICS, the Professional Board for Supply Chain Management. She's a Deputy Chair, a global leader in human resources for supply chain management. She's a firm believer that supply chain management makes the world go round, and that's very true. and is committed to building a vibrant community of educated and professionally designated supply chain professionals throughout Africa. She's a strong advocate that together everyone achieves more, that she believes in teamwork. And in terms of background, she's originally from the UK and brought up in a variety of countries around the world, including African countries like Ghana and Kenya, also the United States of America, but also in the British, Australia and Japan. Jen, you are warmly welcome this evening. The floor is yours.
Thank you very much, and thanks everybody. We've got a couple of slides just to share with you. I hope that everyone realizes that Together Everyone Achieves More is an acronym, and as supply chain professionals, we know we all love acronyms. So remember that one, because we're talking about C's, but at least we've got an acronym now. So collaborate is part of a team. People that deliver is an example of an organization that can also be a leader. Leadership is not just about people, it's also about organizations. And I think that People that deliver typifies one such organization. And all organizations should have a vision and they should have a goal. And I'd like just to read to you the people that deliver vision and goal. Basically, from a vision point of view, and this is where what we see the world should be like. And it's a world where health supply chain workforces are empowered and equipped to optimize health outcomes by improving access to health commodities. That's why we're all here. That's why we're all being educated. That's why we all need to learn all the time. The goal is about the people, individuals, and the goal is about creating competent individuals who are, and I think this is really, really important, who are supported, and that the supply chain workforce is adequately staffed so that we can deploy it effectively across both public and private sectors in the health system. We all know how important it is. You know, in the private sector, if something doesn't get where it needs to be, then the company doesn't make money. In the public health sector, it's actually more important than that, because then people's lives are directly affected. Next slide, please. Thank you. These are all the groovy people who make it all happen. So like I was talking about leadership, people that deliver, they achieve, or they want to achieve, aspire to achieve this goal by forming a collaboration. So here we are with another C, a fantastic body, the consortium, another C, is created all these different organizations that gather together, all like-minded, all with the same vision and all aspiring to the same goal. And you'll see the diversity. So there are private sector, there are public international donor, there's academia, there's professional associations, and there's private sector, all merging together with one common goal, which is to create this well-supported, well-educated and empowered workforce. Next slide, please. And this is the last one. And I think this is a really useful one, because it's, why is it so important? And it's very easy from an emotional point of view to say, of course, people are important. But then the cynics come along and they say, yeah, sure, people are important, but they're going to be replaced by technology anyway. So what's the point? And they obviously haven't worked in Africa very much. And they haven't looked at why supply chain itself is still so reliant and will always be reliant on the workforce, on the people who actually do the work. And so all these elements that are outlined here, and I'm not going to read them all out to you, you can take this away and have a look at it, because we all know it. All these elements combined make a strong supply chain workforce, avoids the fragmented supply chain, avoids individuals working in silos, which is what we're all taught to try to avoid. And I think that, you know, by working together, we can create the right processes, the right formula, the right set of education and skill sets that will enable us to be able to empower the supply chain workforce. We know that the supply chain globally, there is a critical skills shortage. We know that there are a lot of people who are working in public health who are having to do supply chain almost intuitively. They've not been taught. And so people that deliver one of their big aspirations is to try to create a proper set of job descriptions, the right set of education, the right forms of recognition of prior learning, all those sorts of activities that lead towards a strong and empowered workforce. So, and also a self-generating workforce. You know, I certainly, and you know, everyone who's working in this field at the moment knows that while it's critical, while the action takes place, what falls behind? The preparation, the education, and the training. And what we don't want to happen is once we're on top of this pandemic, which we will be one day, we don't want to suddenly turn around and realize there's nobody coming up through the pipeline to sustain this workforce that is so vital. So an organization like People That Deliver leads from the front, delivers, pardon the pun, on what it sets out to do. And together we hope that we will be able to achieve that goal of creating a competent, supported, and adequately staffed supply chain workforce. And from a leadership point of view, I've got lots of comments, but I'm over my 5 minutes, I think. So I'll wait for questions because I hope that you're all going to ask lots.
Thank you so much, Jen. This is very informative. I actually like the last, your model, you know, the HR in supply chain management. And it tells a lot because it shows, like, if we talk about leading people, these are the, you know, the human resource. So you are leading the people, but what about their professionalism? Yeah. What about their job descriptions? What about their credentials as far as supply chain managers are concerned? What about planning and financing for the supply chain workforce? I think this one is also very, very important, and the chief is here. And also, you also included one dimension, that is the fragmentation of the responsibilities. And that is, I think, it's about chaosness, you know, at maybe the health facility levels, but also maybe during the monitoring and control, during the information flow. So thank you so much, Jane. I'm sure these issues will come again, you know, as we start the discussions, but also as we hear from Professor Paul's presentation, who is going to address the leadership in supply chain issues. That how do we look at the human resource aspect as far as our supply chain is concerned? Thank you so much, Jane. Next we have Professor Paul Lavon from Empower School of Health. And he's going to give us a brief introduction about the school, their expertise, and what they are doing and what they are intending to continue to do. Professor Paul, he's a founder and director of Empower School of Health, and he has worked closely with ministries of health, heads of state, and secretaries of health to guide public health strategies. He was the former head of Global Funds Division of Procurement and Supply Chain, and has been an advisor to WHO, World Bank, UNICEF, Gates Foundation, and several other organizations who are interested in transforming the healthcare. Professor Paul, you are welcome. The floor is yours.
Thank you very much. Gladness, first of all, just to check if you can hear me.
Yes, we can hear you.
Great. Next slide, please. I'll be brief here. This is just about Empower, and I really want to focus on the the session when we get into leadership. But just before I do this, thank you for people that deliver and Jenny for your remarks, and of course to Shimelis and Global Fund. To mention that both Global Fund and Empower are members, coalition members of People That Deliver. So, and the role that PTD is playing is significant when it comes to supply chain. So Empower School of Health, our whole focus is on transforming the way people learn, work, and save lives through digital learning and blended learning, like Shimelis said. We started with face-to-face, we've now added digital learning, and we bring the two together. Next slide, please. Our chief mentor, we talked about leadership. Who better than His Excellency himself to guide and mentor us? And he is our chief mentor. And he's been guiding our journey for many, many years. Next. We don't work alone. In fact, the number of partnerships have actually doubled. We will update the slide next time. And this includes regulatory agencies, professional associations and societies, academia, and even within Tanzania, as we started this project, we've teamed up with several universities, professional associations across Tanzania. Next. That's okay. Next. Right. Just to, so the scale that we're able to bring with technology, realizing that it doesn't always work, because we know there are countries and there are places within countries that don't have access to technology. But if we can bring the two together, we can achieve real scale. In fact, our 200,000 trainees and learners are reaching out to more than 1 million beneficiaries in the health sector. So our reach has really grown across 100 countries. And we've done a lot of training, not just in supply chain, but that's our core. We are known in supply chain, but in other areas, leadership among them. Next. All right. So with this, in fact, the work that we've done, both Siddharth and then Professor Andy, who's our Director of Public Health and Training, will be speaking next. Thank you. Sid, over to you.
Thank you so much, Professor Paul. And our next panelist is Siddharth, and basically Siddharth is going to give us a brief presentation about the capacity needs assessment as far as the soft skills are concerned. That from the capacity assessment that was done online, we tried to capture both the needs for the technical part, but also the soft part, because we believe as far as leadership is concerned, the soft part is also very, very critical. Siddharth has 14 years of experience in capacity building and training, both in the public and private sector, where he has been engaged in developing and delivering training materials for various organizations and donor-funded projects, including Global Fund, USAID, DFID, UNAIDS, UNDP, and other development partners. Recently, he's leading the digital content development and quality assurance process for the National Tuberculosis Elimination Program of India. Siddharth?
Thank you, Gladness. I hope you can hear me well.
Yes.
Thank you. Next slide, please. All right. So I won't spend too much time on this, but I think it's very much important to understand the participants, where their needs and gaps are. As Gladness mentioned, before you take on a leadership and a management role, there are some things that you need to have in place. And these are the few skill sets that we assessed. This was a self-assessment. It was part of a bigger assessment that we conducted, both on the technical side and on the soft skills, leadership and management side. The idea was to reach out to 400 plus public health staff working at the tertiary hospitals and the health facilities from 26 regions. So we essentially asked a question around how well do you understand some of the skills needed for working in a team, working as a leader, working as a manager. One was on writing skills. The other one was on presentation skills, numerical skills, IT skills, teamwork, and project management. There were three options that were given in terms of whether you're an expert, whether you understand the subject area or you understand the skill, but you don't necessarily have the full confidence of carrying it out. And the third one was that you do not have much exposure to these skill sets. The percentages that are represented on the screen are the ones where the participants selected that they're an expert. So as you can see, in most of the cases, the participants do need some sort of hand-holding support in writing, presentation, numerical, and IT and project management skills. But in terms of teamwork, a lot of them were more confident of managing teams, and this is consistent with the result of the poll, where the participants have mentioned earlier that they've managed a team of 10 or more. We got a result of about 60%, if I remember correctly, and the result here is 70%, more than 70%. So it does show that most respondents have good competency in teamwork, but they need some handholding and support in the others. So with this information in mind, I think it'll be useful to jump into later on in the session on leadership and management that Professor Paul is going to take up. After this, I would request Dr. Andy to actually showcase some of the courses that we have developed based on the assessment results, not just this one, but also the technical side, and some very interesting snapshots of the supply chain learning game that we have developed, especially for the staff working and the participants who are attending this webinar. Over to you. Back to you, Gladness.
Thank you so much, Siddharth. Professor And?
Yes, I'm with you.
Please.
Okay.
Sorry, yeah. Can you please introduce Dr. Andy before we start? Thank you.
Yep. Professor Andy is a GMR certified global fund procurement and supply chain management consultant. He has a wide experience of more than 25 years working with international funding institutions and bilateral donors to undertake high value pharmaceutical procurement. Andy has also contributed to the major pharmaceutical procurement and supply chain management publications, including Managing Drug Supply by MSH. Those of us who have taken some courses, we know this book, is quite informative and well written. And he's also a specialist who works on HIV or AIDS, TB and malaria commodities. At Empower, Professor Andy leads the pharmaceutical supply chain management training and capacity building portfolio. Professor Andy, you are warmly welcome. The floor is yours.
Many thanks. Greetings to all. Let me go to the next slide, please. E-learning. We say that, and immediately there's often a lot of misunderstanding around e-learning. And I'm sure that many of you listening to this have had some difficult experiences with what are supposed to be e-learning. Just putting a few PowerPoint slides on a server in a remote part of China and giving it a link is not e-learning. The point about e-learning courses is that they are interactive and they need to be focused. If we look at all the major complaints about e-learning, we find that most of them don't relate to e-learning. They relate to people just doing a few PowerPoints. And one of the key complaints is that the course is not relevant to what they're doing in the real world. And that's the key feature of e-learning. We can make it specific. Managing Drug Supply, the Yellow Book, many of you will know, and it's an excellent publication, but it doesn't tell you what's happening in Tanzania. It's an excellent academic theory and background. It doesn't describe the standard operating procedures that you need to use in your day-to-day work. E-learning brings the opportunity to allow us to do that we can't do in a generalized manual. This course is not standalone. As Dr. Shamalis said, it is part of blended learning. It's part of face-to-face courses, webinars, interactive sessions, discussion group, and mentoring. All together with blended learning to bring that knowledge transfer, to bring that interaction that is so needed. It's been through the entire development cycle, from first status, how are things in Tanzania, what is the current problem issues, into design of the course, and then into assessing the design, reviewing the design, adapting the design, making it specific for the people who are going to use the course. Finally, producing it to scale. Course is currently being uploaded and will shortly be available on the MOH e-learning platform. It's made in 2 modules. Module 1 is really about procurement and supply chain in Tanzania. And module 2 is a detailed review of the standard operating procedures. How do you actually undertake them? I'm sure many of you have got a book on the shelf of the standard operating procedures. I wonder how many of you have actually ever looked at it. Perhaps 1 or 2 procedures, but not often more than that. It doesn't get used. This course brings together the opportunity to get that knowledge, to understand where the information is and how to reference it. Next slide, please. Yeah, if we can move to the next
Prof,
slide.
Can I share the e-learning now?
Go to the next slide first, please. Okay, so the e-learning course module 1 is in 6 chapters. So chapter 1 is the PSM framework. This is the PSM framework for Tanzania, not a generalized academic framework. It is the one in use in Tanzania. Similarly, chapter 2, product selection. It's the product selection process in use in Tanzania. And throughout the course, every part of it is specific to your operating environment. Of course, there are quizzes, there are interactive sessions, and there is an overall module assessment. We've talked about measuring the impact. We start measuring the impact by seeing how well people do on the course, their opinion, their feedback on the course. Overall impact is improvement in the supply chain, and that's measured with KPIs a little later. Next slide, please. Okay. Module 2 brings together the standard operating procedures, again, for Tanzania. And again, how many of you actually looked through all the standard operating procedures? Maybe some of you have even written or helped to write some of the standard operating procedures. But have you really looked at all of them? Is that book on the shelf ever referenced? Do we look at that and see how it happens? Okay. Can we share the link on the bottom now, and we can give you a just little demonstration in a few minutes of what it looks like.
This chapter, let's begin with chapter 1 of module 1, which provides an overview of procurement and supply chain management.
Okay, I can see our internet speed is a little bit slow to allow for video.
In this chapter, we will look at the following: overview of the framework, overall structure, resources or supporting functions, PSM cycle, key performance indicators, KPIs, healthcare delivery systems in Tanzania, and chapter summary. Finally, there will be knowledge check questions at the end. The objective of the PSM framework is to allow health supply chain managers to have a holistic view of the supply chain. These should not be considered as distinct, but rather as interlinked components of a single supply chain system, and it is important that these components work in harmony with each other. The procurement and supply chain management cycle.
Can you turn the volume down a bit, Harsha? Yeah, turn the volume down so we can also explain a bit. And you can keep skipping every now and then. As you can see, you need to listen to the full slide before you can go to the next, right? That's a built-in feature, which is why we wait till the end. Yeah. And of course, and also if you notice the voiceover and the person speaking is from Tanzania using a Tanzanian accent as well. Right, so all of this has been, like Andy was saying, it is Tanzanian specific content by Tanzanians. Okay. Andy, back to you if you want to add anything else or if you want to.
Okay, I think we'll stop there and we'll go back to the slide presentation, please, because I'm aware of the time and we're running quite late. And I think people will have the chance to go through it. But again, the key point is it is entirely focused on Tanzania and it brings that through. Supply chain learning game. As an old man, I had to be forced to understand the value of gamification. How is playing a game going to help you to learn a serious subject like supply chain? But yes, it does. And long before e-learning, we were using gamification in face-to-face training programs. And it helps to bring the materials to life. It brings the impact around. And in e-learning, we use gamification to bring that impact as people get the practical experience and the understanding of the consequences of failing. Because you get negative marks and you failed the game. One of the restrictions has been the computer abilities. Now with modern computers, we can use this very simple technique so it's easy to play. Many of you already play online games because the age group that you are in on your mobile phones, this is a similar format, easily done. And it really does have the impact. It really does come through. Next slide, please. So we start as normal with most games with the general instruction. This game is around the WHO Good Storage Practice, GSP. How many of you have ever read the WHO GSP conditions, I wonder? And this is around the SOPs for Tanzania for good storage practice. And yet, how many have even read the WHO document? Gamification helps to bring this to life, helps to make sense of it. It's relatively straightforward. You enter your name, choose an avatar, and there are 10 different game levels, becoming more advanced. And we hope all of you are going to get through to level 10. Next slide, please. So it progresses through different levels. Level 1 is really about the layout. And we go to level 2, which is around safety and security. And with the advent of COVID vaccine coming, a highly desirable commodity about to arrive in countries. How are we going to look after the security? There already are SOPs in place for safety and security. We need to make sure they're implemented. The gamification helps you understand those, what they mean, and how they can be implemented easily. On to cleanliness of the warehouse, through level 4 on how to deal with damaged goods. On to temperatures, mean kinetic temperatures. How many of the pharmacists can remember a lecture way back in year 2 at university about mean kinetic temperature and what it means? On to level 6, stacking levels. How high can we? How wide can we? How do we make it together? Through dispensing and documentation, to estimation, and finally, human resources and personnel. A lot there. Can we play the video on the game now, please? Okay, thank you very much. We can return to the slide deck. So around standard operating procedures, it really is time to implement them. In the polls, many of you reported that you have more than 10 people reporting to you. How are you going to train them? How are you going to get the message around these standard operating procedures for good storage practice through to all your staff? The gamification like this brings it to life. It stops it being so dry and dull and helps communicate effectively with many of your staff. It also provides a point for discussion and competition between different staff. Which level have you reached? And that promotes motivation and learning more as professionals in the supply chain. Okay, that's my contribution. I see I'm out of time, so back to Gladness.
Thank you so much, Professor Andy. Now we have Professor Paul, who is going to present on strengthening leadership and management. Professor Paul, you're welcome.
Thank you very much. So what I'll do is, this is really, next slide, please, touching the surface of the work that we've done. A lot of this work has been jointly done with people that deliver, and the work that Empower did with funding from USAID. And a lot of this content is available globally as well. So this is just, like I said, touching the surface, and there's a longer program around this, which I'll come back to in a minute. So when we talk about leaders and managers, and often we use them in the same breath, it's important to distinguish between them. And if you look at managers, they do things right. They manage change, promote stability. They're focused on execution or implementation. Problems, if they find them, are to be solved. They are results focused. They provide resources and goals. Focus on processes, rely on formal authority. They have subordinates and they organize people. Can you please click? But look at the difference between a manager and a leader. So the manager does things right, the leader does the right thing. So if you compare the two, while the manager manages change, the leader creates change. One promotes stability, the other one energizes. One's focused on execution, the other one's focused on ideas. Problems that are to be solved, and a leader looks at problems that may lead to opportunities. One is results focused, the other one is achievement focused. Whereas one provides resources and goals, the other one provides vision. One is on process, the other one is focused on people. One relies on formal authority, the other on personal charisma. Instead of subordinates, the other one has followers, willing followers. And one organizes and the other one aligns. It's not good or bad. Sorry, stay 1 second. It's not good or bad. They're two different roles and both are absolutely needed. There are times when you have to manage and implement, and there are times you must energize, provide a vision, and bring people together. Both the roles are critical. Often you need different people for it, although an individual may have both those skills. Next. But every leader must have what's called emotional intelligence, and many of you would have heard that, this phrase. But what is emotional intelligence? It has 4 components: self-awareness, self-management, social awareness, and relationship management. And if we look at each one of these, please click. If you look at each one of these, self-awareness is emotional self-awareness, understanding your emotional state. The next part is managing your emotional state, the emotional self-control, being able to adapt, achieving orientation, and having a positive outlook, but not always easy. Social awareness is all about empathy and organizational awareness. So it's not just about the self. You're working in an environment, you're not alone, you've got teams, you have to coordinate. As the chief pharmacist said, you are coordinating with a lot of different stakeholders. And then relationship management, your subordinates, your supervisors, cross-cutting. You have to influence, coach, you have to manage conflict, there's teamwork and inspirational leadership. EQ, emotional quotient or emotional leadership, is all part of this. Next. but it's not always easy. And one must be aware of what are the barriers to effective leadership. And these are some traits that might get in the way, and you have to look out for them. These are just some examples. And there are different tools that are available that allow you to manage, to assess, to review yourself, to help you understand what are your blind spots, what are your weaknesses. So whether if you lack, so these are some of the barriers to effective leadership. If you are easily distracted, if you do not invest or strengthen your team, which is a critical part of growth. If you're not trusted by your team, or if you micromanage, where often you see that, and I'll come back to when micromanaging is actually the right thing to do, but not in all settings. If you don't have an emotional intelligence that you're able to manage, you may lack confidence. And often this happens because many of you are technically very strong, but you may not have been given the training in management or leadership, and therefore you may lack confidence. In fact, today we're doing a project where we are interviewing and speaking to the CEOs of central medical stores across 10 countries. And one of the women who's a current CEO described her journey when she was younger, where she lacked the confidence, and it was one of her supervisors that helped her develop that confidence. And then she's now one of the CEOs. You may find yourself being unapproachable if you're really tough, and that's not ideal either. Close-minded, and sometimes the opposite end, eager to please, where you want to be liked and therefore you are influenced too much. So it's really a balancing of all of these, and many of these can be assessed to see what your strengths and weaknesses are. Next. Every leader and every manager must help implement change. We're all right now struggling with COVID across the world, and public health managers, and especially supply chain managers and chief pharmacists, absolutely have to have a model of managing change, implementing in a crisis. And there are three big components. Next. So the first part is creating a climate for change. Normally, if let's say you want to create change, which is not externally driven, well, it's to create a sense of urgency. Well, we don't need to create that. It is there. COVID is a crisis that the world is dealing with, and in some countries it's worse. You must form a powerful coalition. You can't do it alone. You have to coordinate and collaborate. And you must create a vision for change. And going back again, remember the difference between leaders and managers. You create your vision. And this first section is about creating the climate for change. Next. Engaging and enabling the organization. So there's 3 steps here. Communicate the vision, empower action, and create quick wins. So over here, what we're looking at is a combination of all 3. So you've created a climate for change. Now you're engaging and enabling the organization. And then the third step is, go ahead, click, is implementing and sustaining change, where you build on the change and you make sure that it's lasting, make it stick. Now, what I've just described very briefly in a few minutes is a whole 1-week course just on this one. The 8-step change that can be expanded on. Next. The effective leadership communication. Now, in this case, so it's not just about managing change. It's not about understanding who you are. How do you actually effectively manage and develop a whole advocacy strategy? Next. There's 6 components. You must inspire. You must create, as you can imagine, as a leader or as a manager, your communication, especially if you're going to create change or respond to a crisis, there has to be inspiration for a team to drive through, to work through challenging environments. Many of the health workers today are working in dangerous environments, and the frontline workers are putting their life at risk, putting their family at risk. And we know how many health workers have died in the process. So unless you're able to inspire them, it's not going to work. You must create trust. The team, the staff must know that if things go wrong, you are there to protect them. You are there to support them. You are there to help them grow. Ensure clarity and get feedback. So communication, communication, communication. It's all about how that message is delivered with clarity, and to ensure there is clarity, because we might think that when we've spoken that everything is clear, but the message that is received is filtered by each person in a different way. So by getting feedback, you get more clarity in terms of did the person, did the individuals actually understand the content and information. You must prioritize your message. There's so many things to say. And as a leader, whether you're working at the last mile, whether you're working in a regional office, a district office, or a province, or at headquarters, you may have 10 messages, 10 key points, but you need to prioritize. People will probably just remember the first 2 or first 3. So then create the necessary prioritization when you start speaking. And then, of course, personalize. Unless people relate to it, the communication would be lost. And it's not just about words. You have to lead by example. If you expect people to work hard, if you expect people to make change, you have to show that you yourself are committed to the work that, that you are doing as well. And again, the chief pharmacist alluded to that in his communication as well. So these are just some brief points that, that we've pulled together in terms of the overall key aspects. Go to the next slide, please. There's a far more, in terms of, we had talked about micromanaging. And here, if you see, this is about shaping a self-managing team. Let's assume you have a team of whether it's 5 people or 10 people or 100 people. How a team develops, there are stages of team development. And from the left to the right, you optimize how the team develops. And if you look at the 4 stages, click. So a startup team where people are still learning how and what to do, it's normally a young team or a new project, or it could be a new division. They need more guidance. They need to be shown how things are to be done. And that's the startup. That's their micromanaging is actually the right strategy. You're showing them, here's what to do. The pivotal one, the team members are now starting to pick things up, and you are now guiding them. That's the pivotal one. Here's why you are doing it. You start to explain to them and you give them a bit more information. In the joining, you're not doing everything. You're doing one aspect of it. And the other team members are able to lead their sections. The red node in each case is the leader. The blue node are the managers or the implementers. So in the joining, you are taking care of the overall, you're guiding the team, but the managers are doing and leading their own activity. The self-reliant gets really interesting, where the leader steps out, having guided, having strengthened, mentored, and coached the team. And that leader can go and start another team, another project, another area of work, or take on larger projects. And the team is able to then move on and be self-reliant. And again, this entire section is another week worth of activities and discussion in terms of learning around this as well. Next. Well, I think this is the last slide here in these principles of leadership and management, is how anytime you bring any kind of change, it creates a certain degree of unrest. Whether you change something in your home, in your own daily routine as an individual, or if you bring change to an organization. And if it is difficult, if it is challenging, there's a curve, and this is the Kubler-Ross change curve that's been mapped, which shows that what happens to morale on the y-axis and over a period of time. Initially, there would be denial, then it goes into frustration, even depression. And then the team starts to experiment with the change. They decide, well, maybe this is okay, and then they integrate the change. If you bring a change to your team, don't expect it to immediately take off and be adopted. There'll always be some resistance. There'll always be some people who will wonder if this is the right way to do it and if this is working or not working, okay? And for each step, there is an action that needs to be taken to address it. So for example, if there's denial, you create alignment. When there's frustration, you maximize communication. When there's depression, the leader sparks motivation, and so on. So experiment, you develop capability because there's new change. You can't expect people to know what to do. So you guide them, strengthen them, inform them. And finally, when it comes to decision, you share the knowledge. Again, as the chief pharmacist Dowdy said, and Andy also mentioned, there's knowledge, there's learning, there's SOPs, there's guidelines, but to implement them, the knowledge has to be shared, the learning has to take place. So you go through that process, eventually you're back to the high morale and high level of competence, and the change is then implemented. Next. So we're developing this into a global development leadership program. We've delivered parts of this in different countries over the years. This is with President, His Excellency, the former President of Ghana, and he's usually involved in the in the keynote address at the beginning as well. So as this gets developed and finalized, this can be adapted for Tanzania, it can be adapted for other countries. And again, like Andy said, the work that we do, while we may have a general generic version, we then adapt and apply it for a particular country. Next slide. I think that's the last one. Right. So thank you for your time. Gladness, I hand the floor back to you.
Thank you so much, Professor Paul. That was very useful. I believe people would want to know more, as we all wish to become effective leaders, given the supply chain transformations that are ongoing, the system redesign issue. So we can never ignore the issue of leadership. So I welcome the floor. All participants, now you have time to ask questions. You can type your question through the chat room, or you can raise up your hand. Maybe when we are waiting for the questions from the participants, Professor Paul and our experts, Professor Andy, I would like to ask one question. How now can we link, for example, Jenny, thank you. I would like to understand, for example, now we have the issue of having so many institutions in terms of guidelines, tools, which have to be used, and there is the issue of non-compliancy. How can we explain that with leadership? Yeah. Professor Andy, would you like to say something first?
Yes, okay. For non-compliance, often people just don't know. They haven't looked at the SOPs. They haven't looked at the detailed operation parameters. So the start of compliance is understanding there are rules in place and what those rules are. We then look at how to achieve compliance through motivation. There are many ways to achieve motivation, but key among them is recognition for your skills. And that often comes around through KPIs, through measuring the impact, through measuring the effect. Less stockouts, more consistent supply, being able to meet patient needs. All of that we can achieve if we comply with the regulations, with the rules, with the SOPs. And that starts by knowing what they are and how to implement them. And there the e-learning platform can help you because the SOPs are there. You can find out what they are, and you can help communicate it to all the staff who work with you. And we can use the gamification to help communicate it in a simple and easy way, which people can relate to. If I've got a whole book, 800 pages of SOPs, it's very difficult to sit down and read all of them and make sense of them. Through the gamification, for the e-learning platform, we can access that and make use and make it interesting for people to go forward.
Andy, thanks for that. Gladness, just to add, the other main advantage, and this is where Tanzania is in the lead compared to many other countries, it has its own learning platform, and it's already using it. The advantage of the e-learning courses is that when something changes, a policy changes, a new product is introduced, or perhaps a new diagnostic gets introduced into a country, all it requires is a modification of that particular digital slide. You don't have to change everything. And it's very easy and very quick to emphasize that particular change and share with the entire community. And once you've brought the entire community of practice of supply chain professionals of Tanzania, as you see, whether it's WhatsApp or emails or what have you, whatever channel, it becomes really quick to bring them up to speed. All it would take for the chief pharmacist or the secretary of health is a blast of message and content for them to know what needs to be done. And then we make sure we measure the impact in terms of have they learned? Are they applying the new learnings? And again, e-learning with the help of face-to-face can help measure that as well. Over.
Thank you so much, Professor Paul. Jenny, do you want to add something?
Yeah, I was just going to say very quickly, I think it's also really important for governments to make sure that they regulate the various bodies and the various criteria and expectation, because it's all very well understanding the how to do it, but if you've got 4 different organizations asking you to comply to 4 different sets of regulations, then it doesn't matter how clever or how well educated you are, you've got to do it 4 times to get it right. So it goes back to the whole sort of coalition leadership of an organization that can engage with a government to ensure that those sorts of requirements and regulations are standardized.
Mm-hmm. Okay, maybe I can also, as there was a question from Patrick. He was asking, what are the obstacles to be a good leader in the system in which the decisions are, I think he wanted to say bottom up, in systems where the decisions are they have adopted the bottom up approach. Yes?
Right, very good question. So, you know, there are different, as we had mentioned earlier, there are different styles of leadership. I didn't present that specifically here because it would have taken much longer. If you are working in an environment which is bottom-up approach, you really must have your ear to the ground by definition. You must listen to the individuals who are working in an environment and are giving you the information. And that's referred to in the 9 different traits as democratic leadership, where you're providing, where you are learning from your staff, from your managers. And that is really important in 2 situations. One is when your army of individuals that are working have a really good sense of what's going on in the field, and you happen to be in an office environment or in a central environment, and you are learning from them. So in a situation like this, the bottom-up approach gives you knowledge and information. And once you get that, you sit with the team and you guide and you work with them and guide them appropriately. The other time this works is when you have the luxury of time. The bottom-up approach works when you can sit, you debate, you discuss, you use a democratic approach. But when there's a crisis and you have to respond quickly, then it's usually a top-down approach as the most efficient way. So these different styles are applied in different situations, and based on that, you have a higher or lower chance of success. Back to you.
Thank you very much, Professor Andy. Maybe I can also ask, there's a question that I would like us to talk a bit. Are good leaders born or are they made? Jenny, do you want to say something?
Yeah, definitely. Are good leaders born or are they made?
Over to you. Yes, Jenny.
I think that it's definitely a case of here education is absolutely desperately important. Obviously, there's aptitude, but if you are keen and willing and a natural leader, you can so easily get it wrong if you're not empowered by the theory behind leadership. And there is a lot, and it's something that we have to understand. Our children don't get taught it in schools, and I think it's something that I think we're living in a world where that's being demonstrated by a lot of people who are calling themselves leaders, not really being leaders. And I think that if we can start educating our children at an early age on the skill that leadership is, then that will be a very important thing. I think it's a combination of aptitude and education.
Thank you. Professor Andy, you want to add something on that?
Well, of course, I would add it's both. But I would fully agree with Jenny on that, is that learning and education is key. It's not enough to have the aptitude. That's helpful, but that alone won't do it. You must have that education and background and understanding. And in our organizations, because we've become increasingly technical, we've lost the focus on managerial and leadership skills. We've let that fall away because we're focusing so much on the technical content. We have to get back to that. Without it, it doesn't work. And we need key leaders and leadership skills at all levels across the supply chain.
Thank you so much. There is a question in the chat room, and it's a slightly long question, but the way I've understood, this is from Frank Mushi, is reflecting the complexity as far as the medical commodities are concerned, in terms of, for example, the laboratory reagents that they have short life, you know, and also in terms of stability as far as the demand and so forth. So basically, he's trying to reflect the issue of complexity, you know, as a characteristic of the medical commodities. And maybe we can say, as long as we are driven by the demand from our clients, or we say their pressure, which is also uncertain, it's about the complexity in the supply chain. What do we think could be maybe effective leadership styles or effective leadership strategies? Yes, please.
Let me kick off, and then I'll hand this to Andy. Here again, just to distinguish between leadership versus management. Here, what's needed is really strong management skills. In fact, in the same sentence that Frank asks, and it's a really important question, probably one of the most challenging areas of health commodities is laboratory products. There's Andy will tell you the exact, not the exact number, but the estimated number. I mean, the book of lab products is very thick, as opposed to when you go into essential medicines, essential diagnostics, and what have you. So the challenges of lab, and it's an area we've been working in quite a bit now, including in Tanzania, and also working with the African Society of Laboratory Medicine. It's trying to manage, applying all the elements of good procurement, storage, distribution practices in lab is yet another order. But what we really need is more really strong management skills. So with that, Andy, if you could just share your thoughts on that, that would be useful.
Okay, just to pick up on that, if we look at the WHO Essential Medicine list, there are around 350 line items. If we look at the average medical laboratory, there are around 13,000. So yes, it's a huge number, it's hugely complex, but we can overcome and meet all these technical challenges. Systems are available, mechanisms are available. The key difficulty is that often we don't have the resources to do it, to implement those technical solutions. So the leadership, the management, is to understand, to advocate, and obtain the resources which will enable us to manage. Too often we're trying to do the impossible. We're trying to implement a technical solution without the resources to do it. Leadership brings us the way to advocate and obtain those resources. And in supply chain, over the last 30 years, we've been frankly abysmal at advocating for what we need. We need the resources, and top of the list there is human resources. And we need to advocate for those human resources. I think I should let Jenny speak on that issue as well.
Hold on. I was just thinking we need to find a word that begins with C for advocate.
Campaign.
Yeah, I completely agree. I completely agree with everything that Paul and Andy have said. I hope that answers that question and also provides more stimulus for thought.
So there's a question. So Hamidi asks, what is better, to be more of a leader or a manager? And Hamidi also asked, a single person can be both a leader and a manager at the same time. Hamidi, these are nice twists to the challenge and the distinction between the two. Depending on the role that you are playing, you need to pick one versus the other. If you are in a management role, you need to be a strong manager. And we gave you some examples at the beginning of the slide when I started speaking about management and leadership. When we are, if you are part of the implementation team of, and your job is to roll out, let's say, the COVID vaccine, or to set the ground for building capacity, whether it's for COVID or HIV or Ebola, whatever the challenge might be, those are specific management skills that you would need, and you can be a very effective manager. But if it is an environment where you have to step higher, like the CEO, often the chief executive officer, perhaps the secretary of health, the secretary of health will find it very difficult to manage a team of tens of thousands or hundreds of thousands of health staff. He has to lead. But if you're on the ground, you're often managing. And there's a hierarchy of those functions, and often you grow from technical to managerial to leadership over a period of time. And there are times where you might be doing 90% of your work as leadership, but there'll be some management and execution that you have to do as well. So what is important is understanding the distinction, knowing which one to choose in what situation. Thank you.
Wow. Thank you so much, Professor Paul. We are running short of time, so maybe we close for today. I believe we'll have other opportunities to continue engaging and discussing about these important issues. So now I welcome all of you to participate in the evaluation. Please participate in the poll so that we can get the feedback from the presentations and the discussions. Yes, we would like to know, how did you find this webinar? Is it very useful? Is it somehow useful or not useful? Just your honest opinions. Please participate in the ending poll. Would you like to learn more about leadership and management, that you think we really need more of these types of capacity building as far as leadership and management is concerned? Please answer the questions. You can choose yes or no. Have you taken any e-learning courses from the Ministry of Health? Yeah, this is our Tanzania Ministry of Health, please. Question 4, have you taken any courses with Empower School of Health? Whether face-to-face, a certificate course, diploma or postgraduate diploma course. They have all these certificate and postgraduate diploma courses in pharmaceuticals, supply chain management. So you just need to respond. Is the game-based learning, the game-based learning will motivate you to learn more? Yeah, we would like to know whether you be motivated more based on the game that has been demonstrated by Professor Andy. Maybe you would like to learn more, so you can choose whether strongly agree, or you do not agree. So up to now, we have 47%, 50% of those who responded. 8 out of 8 people. Yeah, out of 8 people, please. We need more of your opinions. Yes, it is 61%, 62%, 63%. At least we should get 70%. Yes, 65, 66%, 67%. Please, can we get
Gladness? Yeah, Gladness, let it go to about 75. I think these this data are important. So everybody, please take a few minutes. We're nearly there.
Come on, everyone, it's nearly the weekend.
70%. Yep. We're almost
so
there.
What we're seeing,
71.
So what we're seeing is that 90%, over 90% found this webinar very useful. Thank you, everybody. Everybody wants to learn more about leadership and management. Interestingly, so far, e-learning courses from the MOH, only 33% have taken courses there so far. So I guess the Ministry of Health in Tanzania need to do more to make sure people are aware of their platform that's already in place. Then about Empower, that's fine. Many people have done all, and then game-based learning, half and half feel that it would, they strongly agree or agree. That's good. 80% have voted, so that's good. I think we can end the poll and just quickly share the results. Yeah.
Yeah, 92%, that is majority, found it very useful. And 100% of those who voted, actually, they would like to learn more about leadership and management. And majority, that is 66%, they've not taken any e-learning courses from the Ministry of Health. In terms of Empower School of Health, 66% have not yet, but they are interested with the courses. And in the last question, that is on game-based learning, whether it will motivate someone to learn more, majority agreed, that is 53%. So we thank you all who participated in this poll. It's very useful as we continue to develop more interventions to support the supply chain transformation. Then I would like to say that you will all have your certificates. You have your certificate of participation as it is indicated there. Yeah, and you also have access to the presentations, and this webinar was recorded, so you can access it. Yeah. Next. Yeah, we have the link. Just go to the chat room. We have the link for the webinar certificate. So just follow that link. You'll be able to get your certificate of participation immediately. Next slide. So you receive your certificates within 24 hours after the webinar. Next. This is the end of our webinar, and this is the third webinar. We appreciate all of you for your participation, and we appreciate all our resource people who are here, Shimelis, Jenny, Andy, Professor Paul. And I'd like to give very few minutes to Professor Paul, given that this is our third webinar from the project. Yes. Professor Paul, can you close?
Thank you very much. Yes, Thank you so much, Gladness. If we can just remove the screen so everybody can see everybody. We had almost 120, 130 people with Facebook and Zoom combined, which is wonderful. Wanted to thank, first of all, Ministry of Health for all the support, not only at the center, but all the individuals who helped support the work, the feedback, guided us in country, and this included all the regions of Tanzania, more than 400 people altogether. Global Fund, of course, for their support that allowed us to make this happen, both face-to-face and online. And we expect to continue providing the support. We've received quite a bit of feedback in terms of the areas that have not been addressed yet, and that they would like support in both technical leadership and managerial. So special thanks to PTD, People That Deliver, and Jenny, the Deputy Chair. Thank you so much for attending this and for your thoughts. Always very useful, and that's been wonderful. And for everybody, you've got access to us. Anything that you would need, please let us know. Like we said, we anticipate being part of this support for much longer. And we have Gladness, of course, is based in Dar, and you have full access to her as well. Gladness, if you can just put your email ID, I think you have already in the chat, so people can reach out to you. And of course, you have access to us as well. Please feel free to do so. Okay. So thank you very much.
Thank you.
It is,
thank you,
my
everyone.
time is 10 p.m. here. My weekend has started a long time ago. I don't know if you can hear the music in the background, but it's going on. I'm supposed to be down there. My wife is there. My children are there. My dogs are there. I'm the only one who's left. So I wish you all a wonderful weekend.
Thank you.
And thank you. Thank you so much.
Thank you. Thank you, Prof. Thank you, everyone. Thank you, Chief. Yes, thank you.
Thank you, Andy, and the Empower team. Thank you for all your help. This was excellent.
Yeah, thank you.